2, 3, go.
Okay, so before I enter the room, I am going to check the patient's chart, and I'm going to look at all of that, and then I'm also going to make sure that they have an order for a catheter, and then I'm going to gather my supplies, everything that I need right here, and then I'm also, if I needed, I would have a person come in with me. So I have a friend coming in with me, another worker to help me with this. So now I'm just gonna enter the room. I'm gonna move this. I'm gonna enter the room. This table, a little wonky. Okay, then I'm just going to wash my hands, and I'm gonna put gloves on. Okay. And then I'm going to ask the patient, well, I'd introduce myself, say my name is Drew, I'm your nurse today, and then I would ask the patient for 2 identifiers. So I'd ask for their name and their date of birth. I would have them state that, and then I would also look at their bracelet, and then I would check it on the computer to make sure that that matches. And then I'm just gonna close the curtain for privacy, and I'm gonna grab my trash can so that I have that right here. And then I'm going to explain to the patient what we're gonna be doing. And I'm gonna ask them for any allergies and if they're allergic to latex or iodine. So you would talk about that. And then I'm just going to put their bed in a good position. So I'm gonna get it higher up to me. And then I'm just gonna take their blankets down. And I'm going to situate them in a good position. I also am gonna stand on this side because I'm right-handed, and so I would be on their right side. And then I'm just gonna pull their gown up, and I'm going to situate their legs in a good position. So like 2 feet apart. Making sure that they're comfortable, but that also I have a space for me to be able to work. And I would also make sure that I have good lighting so that I can see good. And then I am going to take my wipes. I have my gloves on, so I'm just gonna take these wipes and I am going to clean them before we get started. So I'm just going to open them up. I'm gonna go on the right side, I'm gonna go down, and then I'm gonna get another wipe, and I'm gonna go on the other side, down, and then I'm gonna grab another wipe, and I'm gonna really get in here and I'm gonna wipe this down just to really make sure that they're clean. Now I'm going to take my gloves off, and I'm gonna wash my hands. And I am going to put these away. Also, because in a situation that we would be in real life and we would be using iodine, then I would put like a Chucks under them to make sure that we're not messy or anything like that. So now that my hands are clean, I'm gonna set up my sterile field. So I got my thing right here. I'm just gonna see if this raises so that it can be a good working spot. Okay, I'm gonna get rid of this stuff. I'm gonna throw it away. Now I'm going to have my kit here. I'm gonna open this up, and I'm gonna open it up away from me. And I only wanna touch an inch outside of this so that we can keep a sterile filled. Now I'm gonna take my gloves out and I'm gonna open these up over here. Sorry, I hope you can see that. Okay, now I'm going to put on my gloves. Now this hand is sterile, so I'm gonna reach underneath here to put on my glove. And then I'm going to adjust it. Now I'm gonna get rid of this. Okay, now I'm going to take things out that I need out of here. I'm gonna be using this. So I'm just gonna open this up. And we're gonna put this shiny side down. I'm gonna take it like this. Okay, go in here. I'm just gonna put it right there, making sure we're sterile. Then I'm going to take this, open this up. And I'm gonna put this over here, and this also will help us to be more stable or sterile. So I'm gonna grab this under here. I'm gonna just pull that out, making sure that I'm not touching anything. Making sure that it stays. Okay, now I'm gonna pull these out. I have 2 of these cleaning things, so I'm just gonna put one to the side and then I'll get that. So we also have this little name tag that we'll be using afterwards. I'm gonna pull out my saline and I'm gonna take the top off and I'm gonna throw that away. And we have our lube right here. And I'm gonna take this off and I'll no longer be using this anymore. So I'm gonna put that over here. And then now I have things that I need. So I'm gonna take everything. First I'm going to put this on here, my saline syringe on here. And then I'm gonna get this, and I'm gonna open this. These are my cleaning sticks that I'll be using to clean beforehand. And I'm gonna take everything over here and I'm gonna prepare it over here. So I'm gonna grab inside of my box to bring it over. Okay, that's inside, this is inside. I'm gonna carry it over like this. Okay, now I need to set everything up. So I have my cleaning sticks right here and I need to lube the catheter. So I'm gonna grab this and I'm gonna pull this off. And I'm gonna make sure that this doesn't touch anywhere else. My hands are sterile, I don't need that. I'm gonna take the lube and I'm gonna lube it up. So I'm just going to go like this, rub it on here. Okay, now that I have that, I am going to clean it. Once I touch them, this hand will no longer be sterile. So I'm just gonna make sure I have everything I need. So first, I'm just gonna clean. So I'm gonna clean on one side, bottom or top to bottom, throw away. Top to bottom on the other side, throw away. And then now I'm gonna go in the middle, top to bottom, throw away, throw that way. Okay, now we're ready to insert. So I'm gonna take the catheter and I'm gonna go in and I'm going to wait until we get urine. So I'm gonna go in about probably like 2 inches. And then when we get urine, then I'm gonna go 2 more inches. Okay, and now with this hand, because we'll no longer be going in anymore, I'm gonna hold this and I'm gonna blow this up. And then I'm gonna take it off because it can come back, and I'm gonna throw that away. And now I'm gonna tug on it to see if it stays, and it stays, so we're in the right spot. Now, if I would have been using iodine, I would change my gloves, but in this situation, we didn't use iodine. And also, with using iodine, also we would have cleaned them up with wipes and everything like that. But we didn't. So I'm actually going to change my gloves. I'm going to wash my hands. We no longer need to be sterile anymore because we're not inserting anything. So I'm going to take more gloves. I'm going to put gloves on. And I'm going to clean everything up. So I'm going to take this and I'm going to put this over here. And I'm going to throw this away, as well as this. Throwing this all away. Now, I need to secure this and make sure that there is some slack. So I have this securing device. So I'm going to open this up, and we would take an alcohol wipe and we would clean the area. And then I would place this on the leg, so give them some slack so that they can move. And then I'm going to secure this. Okay, and then I would secure this on there. That's secured. And then I'm just going to open this up and I'm going to hang this under here. Right there. And I would write my name and the time on it that I did it, and I would place this on there, as well as I'm going to be getting a UA, and then we would send that to lab and we would document all of this stuff that we did. And you can only get a UA right when you first put this in, within like the first 30 minutes. If not, you would obtain one from this. Also to know that there's different positions that people can be put in if this is not a comfortable position, but this was the position that was most comfortable for them. So now, after putting this on and getting this all secured, then I'm just going to get them back into a comfortable position. And I'm going to put this over them, put their blankets back. I'm gonna put the bed down, and I'm just gonna make sure that there's no kinks inside of here, and that the bed rail isn't causing any trouble, so that it's gonna be going down. I'm gonna just put the bed down to the lowest position. I'm going to clean the rest of my stuff up. I'm gonna take my gloves off. I'm gonna wash my hands. And I would answer all of the patient's questions that they need, and I would document everything that we just did,